Thank you for joining me for this talk. I hope everyone is staying safe. This is the first talk I've given virtually, so please bear with me. There's a lot of conflicting advice out there about what vets should and should not be doing during this outbreak. A lot of the official advice that's been given being open to a lot of interpretation. I hope this talk helps to clarify some of the facts associated with the current pandemic and helps you to understand what we are doing at St Clair to protect your pets, whilst also trying to protect ourselves and our clients while minimising any spread of this horrible disease. I'll start by giving a brief overview of how coronavirus affects our pets. I will go on to summarise the government advice and how we have applied it to St Clair. I'll go into some of the advice from our governing body, the Royal College of Veterinary Surgeons, and show how we have interpreted that advice. The changes necessary are putting a lot of pressure on all veterinary practices across the world, not just St Clair, and everyone is working in a slightly different way to ensure we are fulfilling our professional obligations. My opinions and interpretations of the guidelines may not be the same as other people or other practices. This is just our attempt to do our very best for everyone during this difficult time. I'll end by giving a few requests of ways in which clients can help us keep everyone safe while providing the best care we can. So every veterinary surgeon in the UK takes an oath upon qualifying. The oath states, "I promise and solemnly declare that I will pursue the work of my profession with integrity and accept my responsibilities to the public, my clients, the profession, and the Royal College of Veterinary Surgeons, and that above all, my constant endeavour will be to ensure the health and welfare of animals committed to my care." This oath highlights several responsibilities that are in conflict during this pandemic. We have a responsibility to protect the public. In this pandemic, veterinary surgeons have the scientific background to understand the principles of the virus and the responsibility to protect the public from the risk of coronavirus and lead by example by following the Chief Medical Officer's guidelines. The advice is to stay at home, and we therefore have to have good reason for recommending people leave their home. We have the responsibility to protect you, our clients. We need to make sure that if we do recommend you leave your home, that we can reduce the risk as far as possible to ensure that we do not transmit this disease to you or create an environment whereby this could happen, such as a busy waiting room. Health and safety legislation also provides the veterinary practice with a legal responsibility to protect the staff from the risk of coronavirus as far as is reasonably practicable, which is difficult given the unpredictable nature of animals. Above all, my constant endeavour will be to ensure the health and welfare of animals committed to my care. We therefore need to make sure that we can maintain the health and welfare of all of your pets while avoiding contact with you and other members of staff, which is near impossible. In order to protect our staff, our clients, the public, while treating your pets, some compromises are unavoidable, and I believe that what we are doing is a justifiable way that allows us to fulfil all of our responsibilities in the safest way possible. There's a lot of panic scaring in the media about the role of our pets in the transmission of the disease. Veterinary surgeons have been dealing with coronaviruses for decades. They are not new viruses. Their deadly potential in other species is very well known. Feline coronavirus, for example, when causing feline infectious peritonitis, has a much higher death rate than COVID-19. Very few cats recover from FIP. It only affects cats though. The strain of coronavirus responsible for COVID-19 is new, and with a very, very rare exception that has been seen globally, it only affects people. It is related to other human coronaviruses, such as the one that caused the SARS outbreak a few years ago. The only significant risk our pets pose is acting as a fomite in the transmission of the disease. A fomite is an object or material which is likely to carry infection. If a postman coughs the coronavirus onto your mail, the letter can act as a fomite and you can catch the disease off your mail. If someone with coronavirus coughs on their cat, someone else can catch the disease by stroking the cat and rubbing their face. As such, I recommend that social distancing should apply to people and pets from other households. There is no need to start panicking about the disease risk from a pet. You are just as likely to catch the disease from a contaminated product on a supermarket shelf. We just have to be aware of the risk in order to minimize it as much as possible and wash our hands regularly. Your pet is only a risk to you if it is mixing with pets or people from other households. As such, you should try to keep your pet away from other people and stay away from other people's pets. The government has produced very specific advice that everyone now has to follow. These strict guidelines include keeping 2 meters away from anyone not in your household, staying at home unless absolutely necessary to leave, and working from home where possible. For animal people, imagine a distance of 2 medium-sized dogs between you and someone else. For us, that means we must stay 2 meters apart from other staff members and clients. In order to make this more practical, we have minimized the number of people in the building, with some staff members now working from home. For clients, this means they should avoid coming to the surgery unless absolutely necessary, and we have sought guidance from our professional body to deem which cases can be justified and which cannot. This is a very controversial topic amongst the profession, with no real agreement with some cases. If you do need to come to the surgery, you now must wait outside. Initially, when the lockdown was announced, our governing body released very strict and very temporary advice in order to maintain public safety at the request of the government. We were told we could only see emergency cases and deal with essential prescriptions. The general advice was that if a problem would not become potentially life-threatening within 3 weeks, we should not see it, meaning vaccinations were definitely out of the question unless there's an immediate threat of disease. As the extension of the lockdown was becoming increasingly likely for a prolonged period, this advice was reviewed before Easter. The guidance now suggests that any cases that are likely to deteriorate if left untreated for 2 months should be seen and assessed. More controversially, the guidance with respect to vaccination has become more grey, in that the individual veterinary practice can now consider vaccinations as long as we can protect our staff and clients through social distancing and a clinical need is justified. I've already mentioned that we have taken steps to protect the staff at the practice by reducing numbers in the building. We have appropriate personal protective equipment available for staff to use when needed, and we are reducing client contact as far as possible by keeping the building locked and not allowing clients in. We are performing remote consultations where possible and not performing procedures that are not essential, and avoiding non-essential consultations such as weight clinics and routine nail clips. There are other problems that the profession is experiencing. You'll have heard in the media about shortages of personal protective equipment for NHS workers, and many bigger practices have been donating vital equipment and personal protection equipment to the NHS to help them. This is limited, and we have to act responsibly to limit what we can do to protect ourselves while not putting undue pressure on the NHS supply chain. We are also being advised to minimise oxygen use to ensure it is prioritised for the NHS, meaning we have to adapt our anaesthetic techniques to try to avoid or delay anaesthetics if we can. This all limits what we can physically provide to our clients, and therefore we need to prioritise the cases we are seeing. The combination of less staff, the increased time taken to set up video links and speak to owners on the phone rather than face-to-face, combined with the physical lack of help in the consulting room from the client holding their pet, is meaning that everything is taking longer and we physically must see fewer clients. Please be patient with us and understand we are trying our best. If we don't answer the phone immediately, please wait 5 minutes and try again. So how are we prioritising the cases? This may seem logical, however, in the first instance, we are not turning away emergency cases that require immediate attention or they may become life-threatening. We are also seeing more urgent appointments where an animal's welfare will become compromised if it is not seen. Where time allows, we are then prioritising primary vaccination courses over routine annual boosters. I'll now go through these different appointment types in more detail. First up is the emergency cases that need to be seen as a priority. The following conditions will be considered an emergency and there is a significant risk to a pet's life or welfare if not seen immediately. New onset seizuring or fitting for more than 2 minutes, or having more than one seizure in 24 hours when not on anti-epileptic medication. Collapsed animals that are unable to stand or are unresponsive. Animals in respiratory distress or with significant breathing difficulties. Hemorrhaging, which does not stop within 5 minutes of applying pressure. Obvious major injuries such as fractures, burns, or large wounds. If an animal has vomited more than 3 times in the last hour, or has had diarrhea and is lethargic. if something toxic or likely to cause an obstruction has been eaten, if an animal is repeatedly straining to urinate and not passing anything, or if a female animal has been straining in labour for 30 to 60 minutes with no puppy or kitten being passed. These cases require immediate treatment, and you need to call us immediately and bring the animal down to the surgery. Urgent appointments are now defined as anything that is likely to become a welfare issue if left untreated for 2 months. Initially, we would listen to the problem over the phone and possibly carry out a consultation remotely via video link, and if deemed necessary, an urgent or emergency appointment will be made to come to the surgery. We may be able to prescribe, treat, or advise remotely to safeguard your pet's welfare and prevent you attending the surgery. However, most of these conditions will require attention in the surgery. Conditions may include moderate or intermittent breathing difficulties, non-life-threatening bleeding, progressive abdominal swelling, unknown signs of pain, minor trauma such as a small wound, bite, eye injury or lameness, chocolate ingestion, vomiting, diarrhea or loss of appetite, increased thirst or urination, persistent vaginal discharge, deterioration of a known medical condition, a new significant mass or swelling, or sudden jaundice without previous explanatory diagnosis. Non-urgent cases can be assessed remotely. We have been granted temporary permission to prescribe medication without seeing an animal, given the unprecedented circumstances. However, this is at the discretion of the veterinary surgeon in charge of the case. These conditions may include prescription checks in stable patients or new but minor problems. The urgency of the condition can be reassessed depending on the response to the advice or treatment given. Vaccinations are the most controversial topic. After reading the reviewed guidelines, we have decided to start undertaking primary vaccinations again. However, we are taking extra measures to protect staff. Clients will remain outside while the vaccination is done. We will only be vaccinating animals that are not showing signs of health issues, such as vomiting or diarrhea, and this will need clarifying prior to the appointment. To minimize contact and ensure social distancing, a full clinical examination may not be undertaken, so we might not listen to the heart, and a full examination will still be recommended once the lockdown restrictions are relaxed. All the other advice we normally give during the primary vaccination course will be given by a registered veterinary nurse remotely rather than face-to-face. With regards to booster vaccinations, we do not recommend routine annual vaccination at this stage. These can usually be delayed, and I would be happy with delaying this by up to 3 months with minimal risk of disease in your pet. The immunity is not going to be full at day 365 and be gone by day 366. The immunity is going to slowly wane and provide less protection. However, I think that delaying these boosters by up to 3 months would be sensible and responsible given the current pandemic situation. The kennel cough vaccination should also be avoided due to the reduced risk, as the dogs should not be socializing at this time, and also due to the potential for the live vaccine given to produce respiratory disease in people, which could theoretically make any coronavirus infection or symptoms worse should you get it at the wrong time. Although we may give booster vaccinations if the pet is coming up to 3 months overdue, we will not be doing this for pets registered at other practices. We need to focus our resources on our registered clients and respect the judgment of other practices, as nobody knows what is the best approach at this stage. To help us, you must be patient with the new and temporary measures we have had to introduce for everyone's safety. Please do not be violent towards the staff, and if possible, make payments by card rather than by cash. Payment over the phone would also allow us to limit social contact further. If a visit is required, we are asking you to only have one person accompany your pet. Give us a ring when you arrive and wait in the car park for us to come and collect your pet for examination. You can also download the My Buddy app, which will help us to reduce the number of phone calls coming into the practice, making it easier for clients with a genuine emergency to get through. This can be downloaded from your app store. Once signed in, you can enter our unique practice code shown, which is 44676A. Once signed up, you can request repeat prescriptions, request an appointment, and make general inquiries, which can then be dealt with remotely by staff working from home. This will really help us out. We are able to send you updates about the lockdown quickly via this app, and moving forward, this app has the potential to enable us to send you booster and medication reminders. I'd like to end by emphasising that no one knows at this stage what the best course of action is, and all we can do is the best we can with the information available. Thank you for listening. If you have any questions, please leave them in the comments and I'll do my best to answer them.